Hi, welcome back to Little Steps, Big Gains. My name is Elizabeth. Thank you for sitting down and listening to this video and joining me that has some tips for individuals who struggle with freezing. Now, I am an occupational therapist, so I have spent 11 years trying to figure out strategies, tips, and techniques, and the following are strategies that I have found to be helpful for my residents and individuals, and my motivation is to share those. So that being said, freezing, that is an episode where we're temporarily unable to move. The brain is telling the body to move and the body is just not listening. The episodes that I have seen to trigger the situations, triggers for freezing include stressful situations, distractions. And what I mean by distractions is not just people talking, which is a huge one, but also clutter and hazards in the way, because now we're trying to think about maneuvering those things and their barriers. Doorways is a big one. Thresholds is a big one. Turning and pivoting. And so because those are areas that could trigger episodes, those are some of the areas I'm going to address. Now, this video, to be honest, is geared towards individuals with Parkinson's because of my experience there. However, it can have applications for other populations. And the reason I say that is because we are going to kind of swerve a little bit into Parkinson's. And when it comes time to Parkinson's, there is a difficulty with movement because of a deficiency in a chemical called dopamine. That chemical provides communication between the brain and the body. And according to the Parkinson's Foundation, by the time somebody is diagnosed with Parkinson's, many times up to 80% of their dopamine is already gone. And the only reason I share that is because to show the essential importance of preserving the amount of dopamine that we do have, as well as slowing the degeneration of it. Now, there's two avenues to do that. One is medication and the other is exercise. And I can't really talk a lot about medications because I'm not a physician, but I can recommend that you talk to your neurologist or movement specialist about timing of medications. My experience is a lot of time my residents are struggling is because they're taking their medication at the wrong timing. Especially a lot of neurologists talk about taking it before versus after meals and watching protein and the timing of protein intake, because protein can possibly bind to the receptors that dopamine wants to, and if it's blocking it, then the dopamine can't and it becomes inefficient. So talk to the doctor about timing if that's one of the triggers or causes for freezing. Now, exercise. Exercise has been shown to change the brain in and of itself, and that is called exercise-dependent neuroplasticity. And my motivation for sharing that is exercise is literally medicine. And so therefore, it's not just good, it's absolutely essential. And so really investing in exercise. And the research shows boxing is phenomenal. And so there are Rock Steady Boxing. It started in Indiana and it is spreading. Google a little bit of Rock Steady Boxing or just boxing for Parkinson's in general. Cycling, Nordic walking has been shown to be really good. Tai Chi and LSVT-Big are some of the ones I've explored that I recommend that you explore because exercise is medicine and that can help as well. Okay, so now we transition to therapy. Now there are three main approaches that we use for individuals, or I use with individuals who struggle with freezing. One is restoration, and this is where we want to address the problems. Two is compensation, where I provide tools to help the underlying problems, to offset the problems, I should say. And then adaptations, ways that we can live still despite the struggle. So let's start with restoration. I need cue cards here. Restoration. Okay, posture is a big one because when my residents or patients are hunched over or falling forward, think about where my center of gravity shifts to. It shifts forward. What do I need to be able to do to advance a foot? I need to be able to unload. And if I can't unload because my weight is on my toes, then that's going to exacerbate and make this whole freezing thing even more difficult. And that also takes me to the next one, which is our base of support. If my feet are too narrow, that also makes it very difficult for me to shift and unload in order to step. So those are two situations in which we can, number one, posture, we can work on posture exercises. Lspt.Big is huge for that, Tai Chi, and I have actually put together some exercise programs in this video on my channel, Lsteps.Bgains, that help with posture. But I would explore looking at posture. Secondly, that base of support, that is something to be mindful of, especially with sit-to-stands. And that's where family and caregivers step in and kind of say, look at that, let's widen that base of support. So those are two mechanical things: posture, base of support. Now, the next thing in terms of therapists is education on the sensory motor disconnect that comes with Parkinson's. And what I mean by this is, there is a mismatch between what the brain is telling the body and what the body is doing. There's incorrect feedback there. So, and the person that has Parkinson's, the individual may not know that. So here's an example. They may think that they're speaking loud, but they're actually whispering. That individual might think that they're stepping big when they're actually shuffling. So there's this sensory motor disconnect. And there's a lack of awareness for the actual individual, which is not their fault. But that's kind of what's going on there. Now, what we can do about that is really work hard to be intentional by overriding it. And if we think that we are, so for the individual, almost shout. Even if you feel like you're shouting, technically you might be talking at a normal volume. Same thing with walking. Feel like you are like taking ginormous steps when you actually might be having an average stride length. When it comes time for the voicing, singing has been shown to be extremely beneficial. Lspt.Big, I know I'm certified, but I'm just sharing that as a resource to look into. But singing, all of those things have been shown to be very good. Respiratory muscle strength training is also very important. And that's a lot of times our vocal cords can bow with Parkinson's, but we absolutely need that breath support, especially the diaphragm. And if we're kind of hunched over, now our lungs don't have the expansion there. So respiratory muscle strength training. I have devices that I love. Email me and I can share those with you. So that would be the whole voicing thing. Now, when it comes time for stepping, I'm going to show you some strategies to address that, but just to be aware of the sensory motor disconnect there, because that can be overridden with just being intentional. Now, here's another area. Anxiety can trigger episodes of freezing. And so there's a few things here. Self-soothing strategies, pursed lip breathing. I took a 12-week course on anxiety, and we did a lot, and I learned a lot on pursed lip breathing and how powerful breathing is. And this is where we breathe in through the nose for 2 seconds, out for the mouth for 4. It's always double. So if you want to do 3, 5, but breathing in, through that nose, breathing out through the mouth, because you need to expel all the carbon dioxide, and slowing that. Shallow breathing is going to trigger something called the parasympathetic nervous system, which is going to exacerbate the anxiety and then make this worse. And if we're not expelling all that carbon dioxide, it gets trapped behind, the oxygen can't get in, and so we're really struggling with a few things here. Now, panic attacks, I have found personally, me, myself, and I have found a few things to be effective for in the middle of a panic attack. One is ice on the forehead, holding the breath for about 3 to 5 seconds, and then letting that breath out, and then try to follow that by deep breathing. The ice pack and the holding the breath for my patients has almost not stopped it, but kind of taking us back. Okay, here we go. Shock the systems is what I mean. That's kind of what it does. I have found that to be helpful with some individuals in the middle of a panic attack. Another huge thing is meditation, and there's some apps, free apps, that I look into, and some have meditations for in the middle of a panic attack. And they say things like, okay, you're safe. We can handle this. And then let's take us back to reality. What do you see? What do you feel? What do you taste? What do you smell? And kind of bring us back to reality. Meditation in general has been shown to be extremely effective for anxiety in general. So looking up some apps might be good. Pursed-lip breathing. Those are some of the things that help with anxiety. Along with that category, before I move on, is sleep hygiene. Lack of sleep has shown to exacerbate anxiety, frustration, and there's a connection between freezing there. So working on sleep is huge as well. Okay, so those are the restoration category for therapy. Now we move into compensation. And compensation is tools that I provide to try to offset the problem. Within this category, we have external cueing devices and internal cueing devices. External ones. This would include lasers on the ground. And I haven't used a lot of cane lasers, but I have used U-walkers for lasers to give yourself targets. Another thing in the house I've used is tape. So I had a lady going to the bathroom, and she let me put tape along her floor from the doorway to the toilet. And that helped her have targets where she could step on the tape and make her way over. Another option is agility dots that have some traction under them and are colored. And I've had people step on agility dots as well. I do agility dots for exercise. So I have agility dots in front and I'll say red and we step all the way on the red one. And then we have to use these modified plyometrics to get us back again because that's where power comes in. And balance because we don't want to keep going. Okay, so those would be some external cueing devices. Along with that would be metronomes. And there's free apps for metronomes where you can attach it into your headphones. And I had a guy who he would go to the mall when it wasn't crowded, right? Stressful situations, put his metronome on in his ear and walk to the beats. As well as individuals outside. It's just easier in the mall. If it's smooth surface, no stress, no crowds, that kind of a thing. Really got to watch the crowds. But metronomes can be really beneficial. Now, as a therapist in external cueing or as a family member, I do tapping on my leg while we walk. So let's walk to the beat together. Ready? 1, 2, 3. 1, 2, 3, which takes me to counting. Counting is a phenomenal technique to help with freezing. Usually 1, 2, 3 is a phenomenal or the go-to for me, but I tap on the outside of my leg or I snap. I like tapping better. So if you're a caregiver or a therapist here, try tapping, try counting. Let's help that person. Let's work together to help create that beat if we don't want to put a metronome on, which we can do that too. Okay, those are external. Hang in there with me. Now we go to internal. Now this is in our head, counting in our head, singing in our head. I don't sing out loud. Visualizing targets in our head. So seeing those targets. And that'll take me to a step prediction strategy in a little bit. Those are internal strategies. Now in the middle of a freezing episode, they recommend, or I've learned the category, the technique of the 5 S's. Number 1, well, first off, never fight the freeze. So if we're struggling, the more you fight it, the worse it will be. And this is where family members come in when they're saying, come on, hurry up, come on. Or they come to me and say they just don't listen. And I say, hey, you're not listening. Come with me, let's talk alone. This is not our fault over here. So the best thing we can do is actually just stop completely. Stand tall, because remember, we want to try to unload our weight off our toes if we can. So we stand tall, we sigh, just try to get some of that anxiety out. Then from here, the next S is shift our weight. And sometimes we have to do this a few times, but the reason for this is we need to shift in order to unload, right? If my weight is in the center, it's harder for me to unload a foot to advance it. So this is where we stop. We shift our weight. And I have a handout for all this. And then after we shift, we start over. So real quick, that was stop, stand tall, sigh, shift our weight, and start over. The 5 S's, this is on the handout. I have found that to be the most effective strategy. Now that takes me to the step prediction strategy. And this actually has to do with preventing episodes of freezing. And I have found this to be extremely effective across the board if you're a family member, a patient yourself, and therapist. Listen. Okay, so now this is where we, instead of taking a long destination, we cut it into a short destination. And we start counting steps, and we want to make it to the short destination in as few steps as possible. So what I've done many times as a occupational therapist is we go from the bed to the bathroom. That's my big go-to. And I'll see how many steps I did this recently with my wonderful 67-year-old female, and she took about 18 steps to get there. Okay, now we're going to do it again, and I want you to do it in 10. Okay, that forced her, we're counting, and I'm like, oh my gosh, you're on 5. Like, we only have 5 steps left. And then she's really focusing on big. And so every single time, and guess what? She did it in 10, by the way. Okay, so then every single time you go to the bathroom, I want you to count, and I want you to do this in 12 steps or less. That is a step prediction strategy. In the hallway walking, if I have 175 feet to go towards a nursing station or something, or parking lot, so what I do is say, hey, I want you to take 10 huge steps for me. Don't look down there. Right here. Either find a target like a doorway. See that doorway? I want you to make it there in 10 steps. Or if I don't have, that's the best deal. But if there's nothing there, I would just want you to do 10 huge steps for me. And that's how we advance. And actually it helps predict episodes of freezing. So that's called a step prediction strategy. Hang in there with me here, okay? I make that an exercise in the house. So with my home health patients, if I find an avenue where it's about 10 steps, that's great. And every day I say, okay, this is part of your exercise. I want you to take 10 huge steps down. And now turning is a trigger. I'll show you a clock turning strategy. And then we're going to use that strategy. And then we're going to take 10 huge steps back. We're going to go back and forth doing these laps. I want you to do it 5 laps, 10 huge steps. Because now we're practicing those large steps. And we also need to be aware of overriding that sensory motor disconnect where we think we're stepping small, but we're actually stepping either big or a normal stride length. So that's called a step prediction strategy. I highly recommend trying out and trialing. Okay, now that takes me to turning and pivoting. Okay, so here's a big thing. Individuals who struggle with freezing might struggle going forwards, but we don't struggle as much stepping to the side, okay? Side stepping is so useful. So when I have a resident, so we want to make large turns. And so when I have somebody struggling, and I'm not going to sit on my dogs, okay? But if we need to go from A to B, instead of stepping forward and then trying this 90-degree pivot thing and then stepping back, which is very difficult, we're going to make a wide turn. You see that? I want you to sidestep there. Sidestep. Sidestep. Okay? And we practice pivoting and turning on and off our surfaces with, if they have a walker sidestep. Walker sidestep. And I want you to take it in 3 side steps. That's just an example if 3 is appropriate or not. But we just practice big sidestepping. If I have a grab bar in with a resident, and this is, I work with all levels, young, old residents with Parkinson's. So if we have to use a grab bar in a toilet and we're on a wheelchair, we stand up, and instead of turning and then stepping back to the toilet, we stand up and then we sidestep there, right? Sidestep, sidestep. Once we're here, then we sidestep again and sit down. Okay, so use sidestepping in life because it can be a phenomenal technique since sidestepping is actually a lot easier than advancing forwards. Something to be aware of if we're like kind of stuck somewhere and we need to be turning, try to sidestep instead. Now this takes me to my next turning strategy, and this is called a clock turn strategy that I learned from a research article. I actually have found it to be helpful with some individuals. This is where we're walking and we need to make a whole 180, okay? So instead of doing this, I say, I want you to plant 1 foot, keep that foot there. And I want you to turn the opposite foot like you're making a, turning into a clock. And usually with Parkinson, since it starts on one side of the body, one side might be easier than the other. So we're going to do that, and then we're going to walk back. And this was successful with my 92-year-old who got married again. We were stuck at the end of the aisle. And so we practiced this clock turn strategy, and his little bride just kind of went around him, and it was wonderful. So I recommend trying it, a clock turn strategy. And so with my step prediction strategy, my residents, we walk down for 10, practice a clock turn strategy, walk back for 10. And that is an option to try that I have found to be helpful, or at least easier than the other strategies, or trying to muscle through. Okay, so those are two options that have helped with turning, and that would end my section on compensatory strategies. And now we go to adaptation, and this is where we have to almost make some lifestyle changes so we can still live our life despite these episodes of freezing. And this is where assisted devices might come in. I found U-walkers to be very, very helpful. I have found Nordic walking to be very helpful, but Nordic walking I use for individuals that don't have walkers or canes, or have the balance to do it. And the reason why Nordic walking has been very helpful for my residents is instead of leaning forward, where we talked about our weight shift being on our toes, Nordic walking poles help us stand upright. They give us the support we need to stand upright. Now, if I have an individual doing this, and I can't recommend that you try this without knowing your balance status, but for younger individuals, I actually don't tell them how to do it. Because if I give a poll and I say right foot, left, right arm, left foot, it's confusing for anybody. So I just say, hey, walk. Let's just walk. And then soon enough, as we get moving, then that opposite technique kind of kicks in. So I can't 100% recommend that, but if you're younger and you're already mobile without a device, maybe try using Nordic walking poles or walking poles in general and give it a shot, possibly. That's a hard one for me to recommend. Okay, so adaptation, and then where caregivers and family members come in, teaching them the 5 S's, self-soothing strategies, anxiety, having a loved one with panic attacks. What can you do for that person? Can you go get the ice pack? Can you turn on the phone that has that meditation? Can you walk them through something called progressive muscle relaxation, PMR? You can research that. Lots of research on progressive muscle relaxation as a technique to do at times for self-soothing and help us with anxiety. I found that to be helpful too. Caregivers to notice things like posture, to notice that base of support, to encourage us to bring that base of support, to know about things like doorways, thresholds, clutter, to know maybe let's not talk during walking because that's just too difficult. Our brain, it's just going to block. It's like blocking the traffic flow. You're a barricade in the middle of the road. So let's take that out of the way. So this is where caregivers come in, and you can have them watch this video so they understand some of these techniques that they can do their part to help. That's a lot. I did include a handout on some of these techniques that have been successful for some of my residents to help. I had no idea this channel I created as a vision to create 30-day challenges in terms of exercises to help people when they leave my facility or my care or in the community. Instead of just giving pictures, I want you to do this challenge for 30 days. Exciting, right? That was my vision. However, I know I'm talking too much here, education has been very popular. And so I have some more educational videos coming up. Things like tips for putting on shoes, compression stockings, over 11 years of research on this stuff. Now, I have a whole community of therapists I'm a part of. So if you have a request of, like, for example, I am struggling with compression stockings, please email me, because I will put that, I have some techniques on my own, but I will put your question in my OT community. I will get their answers and give them back to you. thousands of therapists. Let's see what this huge community can provide for you. Resources. So my email's here. Feel free to contact me. I can be that medium to help because I'm all here, all about trying to provide resources and help us through this struggle. So thank you for coming, Little Steps, Big Gains. I appreciate your joining. I hope that you found some of this beneficial and maybe some tips or strategies to help you.